Hello and welcome to this very first episode of AUMHUM Talks. In today's episode, we have our esteemed guest, Dr. Ila Binaykia, somebody both me and my co-founder we have known for a very long time, and we've always wanted to have her as a guest in AUMHUM. Uh, Dr. Ila is a consultant pediatrician, COO of Healthpoint Hospitals in Ranchi. Uh, Dr. Ila, welcome to AUMHUM.
Thank you so much. Thank you so much, Aviral and Anumeha, for having me here today. It's a privilege and an honor to be talking about such an important aspect of child mental health and well-being.
Wonderful. And I'm also joined today by my colleague, Soumya Singh. Uh, Soumya heads the psychology department in AUMHUM, and she will be leading the discussion with Dr. Ila. Dr. Ila has more than 15 years of experience in treating children of all ages, for that matter. I think toddlers, adolescents, as well as uh, I would say infants. And that said, I would leave it to Soumya and Dr. Ila to take this discussion forward. Today's topic is more related to anger, and uh, a lot of us can identify with anger, not just in kids, but even in grown-ups. But as parents, how to deal with latent as well as active anger that they see in the kids. I think that's the most pervasive question that we receive from our audience. And I would let Soumya and Dr. Ila to take this forward.
Hi,
Thank you,
Soumya.
and thank you, Dr. Ila, for being here and for starting our first session, AUMHUM talk session. So the today's topic is understanding if a child's anger is just a phase or a concern that we should be looking after. We'll dive right into the topic, like parenting. So parenting is a journey of its own where there are so many challenges and so many rewards, and no matter at what stage of parenting you are at, either just starting or have already raised 2 3 kids, you are still always puzzled by your child's behavior, wondering what is normal or what is something of concern. And especially when it comes to anger, parents or in general everyone feels that anger is a negative emotion or anger is something wrong, but it's just that anger has some healthy ways or unhealthy ways of expression, and that goes along with kids as well. When it comes to anger expression in kids, it gets even more trickier as with age and every step they take forward, their way of expression also changes. So our aim for today is to help parents navigate through these tough, confusing behavior traits of their kids and help their child regulate their emotions in a better way, so they can express their anger but in a much more healthier way. So to shed some light on this topic, we have Dr. Ila with us. Thank you so much for being here, and I'll start with the first question. So, can you help us understand what a normal expression of anger is in a child, and what is something that a parent should keep an eye out for? What are those signs that one should be alert of?
Right. Thank you so much, Soumya. There's something very important that you mentioned right away, is that anger is something which none of us want in our lives. Neither does the child want to be angry, nor does the parent want to be angry with the child. So it is very important to remember that the anger is just a symptom. The actual problem and the actual reason which leads to anger is always more important in children, because as compared to adults, they do not have the ability. They're still in the growing phase. They do not have the communication skills, the self regulatory behavior, and the maturity to see how they are behaving. So, coming to the point, yes, it is very important to identify that which anger is healthy, which is acceptable, which is normal, and what should raise our eyebrows and be a cause of concern to the parents. So, like I mentioned, we should always remember that no child wants to be angry. They always want to be their parents' favorite person and do things that will please their parents. So, but of course, I think parents, because they're so overwhelmed, and today's the pace of life which we lead today is actually so overwhelming that I really can't blame. I think even they need strategies to cope up with their own emotions. It's not just the children. So, coming back to the question, I think anger in children should raise a flag when it is persistent, when it is disproportionate to the normal circumstance, when it is a cause of danger to themselves or either to people around them, when you can see that they are not being able to gel well with people in their school, they're not being called for birthday parties, for play dates, you can suspect that this kind of behavior is something that needs to be addressed.
Yeah, so I'm trying to understand this a bit better. Uh, Normal anger and anger that should be concerning. Uh, so, for example, if a child does not uh, get what they want and they are showing a temper tantrum, we would consider that to be normal. And if a child is, I mean, there has to be a reason, or if the child is just expressing anger without reason, uh, is also normal, or is it a cause of concern?
So, very important question, Soumya. We have to understand that for the child, for us, it might seem a very trivial thing, but for a child, those are big emotions. And anger is always the inability to process big emotions in children. So, if they are really frustrated and stressed out, it is especially in younger children and in adolescents for different reasons. So we'll come to that. An adolescent brain is a very rapidly growing brain. They are really overwhelmed with, suddenly it was like you could only process a limited amount of things, and now because your brain has the capacity, things that you were not able to see before, understand before, comprehend before, all those stimuli come right at you, and they are still learning how to process it. So for adolescents, it's different, and for children between 1 to 7 years, it's actually because they're in a primitive stage of development. And you see, of course, it's also a function of their personality and the environment. So genetics plays an important, plus the environment. We cannot control the genetic aspect, but we can definitely modify the response to anger in a child. And that is one biggest tool which the parent have. And they will see that if they can just take care of this one thing, that is uh, controlling how they respond to the child's anger, it will change things in a positive way for both the parent and the child.
Uh, well, there is one way of expressing anger, and that is physical
Hmm.
aggression, where a child could throw things or hit someone, and these are also very commonly seen in school-going kids.
Yes,
Uh,
yes.
Adolescence, it reduces, but still we see it going happening till a very older age as well. So,
Yes.
uh, in terms of physical aggression as well, what is okay and what is not okay?
No, physical aggression is not okay. The best time to talk to children about setting boundaries and establishing clear rules is when the anger episode is over. So, when it comes to addressing anger in children, there are two parts to it. One is when the anger episode is going on, and one is after it. So, this comes in the after part. This is the best time when the you often have to, and the best way to diffuse an anger situation is to just step out of it. So by choosing, and trust me, it's not easy. As a mother of two children, and one is now stepping into adolescence, trust me, it is very difficult, especially when you have a long, hard day. But being mindful, we can easily do it. So whenever there is a tantrum or a meltdown, either with younger children or with older
Mhm.
adolescents, the first thing you have to do is take a pause.
Mhm.
Take a pause, step back, and think what could really be the trigger for the person to act in this way. And we are talking about normal situations now. I'm not talking about situations in which we are suspecting that the child has other psychological issues like ADHD or anxiety or learning disorders. We are not talking about those right now.
Yeah.
So it is very important for the child, for the parent to pause, step back, and identify the trigger. It is very important for them to stay calm and collected in that situation, because not only are you helping to diffuse the situation, you're also setting the example, being the role model for your child. He exactly knows what behavior he has to emulate. So,
Yeah. Uh, so this makes me wonder what could be the
mm,
underlying causes of these behavior. If a child is acting out, as they say, or being very aggressive, what could be something or things that we can pinpoint being the reason for it?
right. So, this is where the role of a pediatrician and a psychologist comes in,
Hmm.
because majority of the because parents themselves are emotionally involved and not uh, unbiased enough to arrive to this decision in most cases. That is the truth.
Hmm.
So, if you think that it is persistent, it is causing a problem in your day to day life, it
Hmm.
is spoiling the relationship between you and your kid. You really want to be loving, supporting, but you're not unable to do so because of the anger outburst. I won't say that all kids are manipulative, they users, but they eventually learn, especially if they're having a tantrum, which in wherein they want a particular thing, and you give in. You give them that thing which they wanted. Maybe you had decided, maybe you had not talked about it. The best is that when this episode was over, you talk to the child and you set clear expectations. But maybe you had not done it and you ended up giving in to his tantrum. This, in his mind, in his psychology, is a reinforcement. He's very likely to do that, repeat that behavior again, because he knows that doing it will get him what he wants. So, yes.
Yeah, I completely agree with that. I would like to add a
Hmm.
few more points into the
Yes.
underlying causes. So
Hmm.
there's in today school environment has become more stressful, and
Right.
some kids would respond differently to the stress, and those things are also very important for a parent to figure out, like if the child is being bullied in school or has too
True.
much workload. These things could be the reason for them acting out. One thing that is like very common, and I would say that is for applicable for us as well and kids as well, is not eating properly or sleeping properly. It's like anyone who doesn't uh, do the basics end up being more irritated and frustrated.
Very
And
true.
yeah, figuring that out is, I mean, that's the, I would say, the first step to figuring out like if the kid is having food properly or sleeping properly. And as you said, how the parent reacts, the child will adapt, and modeling is a major part of parenting. And if a parent shows aggression, the child would respond similarly in some way or the other. So that's a difficult task for sure, but it have to look out for these subtle behaviors in
Yes.
kids
So,
and
to interrupt, but this is where parent and child coaching comes
Mhm.
into play.
Yes.
Especially in smaller children's, you have these therapies where the parent and the child both are made to enact the situation, and then the response, they are taught to learn the correct response.
Mhm.
And it is, trust me, it is just maybe the 90% of the work which is required is
Yes.
to improve, or I mean, correct your own response to your child's anger.
Yeah. I'm sure a lot of parents listening to this would be nodding and agreeing to a lot of
Mhm.
points. and looking forward to understanding more. So that leads me to my next question, that is once the parent has figured out that this is not a typical anger behavior, or this is not a typical behavior, then what are some of the ways and strategies that a parent should move forward with?
Right. So I'll first deal with the smaller children, which is 1 to 7 years category.
Mhm.
Uh, these children usually have the ones who are angry often have
Mhm.
very big emotions which they are unable to process themselves. So they lash out, they act out, they are not able to self regulate their emotions. So we have to teach them how to get there. So, coming back to the point, while they're angry, the best thing is to step back, take a pause, think of what the triggers could be. One trick that I found out really works for me is to get down to their level. When you have some adult towering above them and shouting, not even shouting, telling them those big, big sentences with a lot of deep meanings and a lot of emotions, it's not easy. So you get down to their eye level, and if you can, if they allow you, you can physically hug them, or just show some touch of concern, some gesture of love. And then you have to, provided they are not Superman, there are also, I have seen kids who go really mad and they will probably be aggressive and try to hit you if you try to come and pacify them. So the easier ones is you tackle them, you just diffuse the situation, you step out, you look into their eye nicely, calmly, use a very calm voice, the calmest voice, and tell them that we can talk about this when you are relaxed, both of us are relaxed and in a mood to talk. And you just leave it there. After the episode, of course, connecting and communicating with a child is super important. So this is all the background work that you have to keep continuously doing so that you do not even arrive to a situation where you have to diffuse anger. And I really believe that the effort that you put in the first 12 years
Yeah.
shows later in adolescence. If
Mhm.
you have made that effort to establish the connection, create that bond, you will see that it becomes much less, the adolescent years are much less tumultuous. So, yeah, that is how you deal with when they are relaxed. You talk about what happened, about their deeper emotions. If they're anxious about something, very often anxiety often shows up as anger. And trust me, I think of all the reasons behind anger, anxiety is the commonest issue
Yes.
in children. It's difficult for them to comprehend and to express what they're anxious about. So you ask those deeper questions, open-ended questions, and you listen to them.
Yeah.
That will solve a lot of problems.
Yeah, as you mentioned earlier, I think
Hmm.
one more important, that was an important point for a parent to understand that the child is feeling these emotions for the first time. So for them,
Right.
what seems to be a very big thing, we might not feel like that it's a very big thing, and just understanding that this is bothering a person, and this is something that is a cause of concern for this person. Basically
Yes.
empathizing at their level can also help a lot in calming the kid down. I've seen this
Yes.
happen a lot where I've seen this happening with myself as well. If I'm talking to someone younger and they're
Hmm.
talking about some problem, my first thought would be like, this is not that big of a deal. Why is this person bothered about it? But yeah,
Right.
a parent changing their own perspective also matters a lot in such situations. Yeah.
Very true. Hmm.
But often, like in adolescence, when they have entered the difficult years, or basically well, teenage years are the more difficult ones. So during that time, I feel that even when trying to pacify them or trying to help them understand uh, that what they are behaving is wrong in some way, uh, it usually make things worse, and they end up becoming more rebellious or acting out. So what to do in that age group, like how to deal with that?
Yes. So coming to the adolescents, there are two things which the parents should remember.
Mhm.
One thing is that their brains are going a very rapid change. Their prefrontal cortex is only develops in adolescence, and it is where the higher mental functions, the cognitive abilities, are present. So it is a lot of change in very less time comparatively. No other phase of your life will you actually change so much physically and mentally. It's even the physical changes which actually make them overwhelmed. And the second thing is to remember that this is just a phase. I know it's a very long phase. 5, 6 years is not easy, but they are just getting ready for the person that they're going to be. This is not permanent. This is not how they're going to be. So if
Mhm.
they're angry, agitated, aggressive right now,
Mhm.
you just have to remember that this is not the final product. It's in process now. That understanding will help deal better, because often we think that यार ये तो 13 साल के हो गए, 14 साल के हो गए, हमने इतने सारे साल मेहनत की है और देखो ये नतीजा.
Yeah.
But that's not the case. Every hard work and good work that you put in stays. Is just that they are overwhelmed with the pace of change.
Yeah.
So understanding that, and of course, like I said, remaining calm, composed, giving them the time to diffuse, and talking to them when they're ready to talk. It may take a long time, and very often this is very typical of adolescents, that after the anger, after the episode is over, most of them won't even remember what happened. They'll be like back to their normal happy selves, and it's not something that they'll keep in their heart or their memory. So that is one thing we have to remember.
Yeah. Well, parents often try to either be very strict in these type of situations, and sometimes even kids get really rebellious, which makes it more difficult for them to uh, figure out. So they start controlling more, or the other way is that they start becoming over friendly. So I have seen that happening a lot. How to figure out that balance, that you are being at a position that you're authority, but also not being an authority in a way that undermines their value or their place.
Right. So till your child is 18 years,
Mhm.
you have to keep telling yourself and reminding them that you are responsible for their well-being. So
Mhm.
the primary accountability lies with the parent,
Mhm.
and the boundary or the limits that you want me to clearly express is actually based on the child's personality.
Mhm.
And every child is so different that it will be wrong on my part to give a fixed guideline or a fixed prescription on how the parent should behave, because some kids are really very understanding, mature. Maybe they have had those life experiences. Maybe they've had to take so many responsibilities that they will deal with things in a more pleasant way. So you always have to remember that you should not lower down your standard. You don't have to lower down the bars of what is minimal expectable behavior. You just set that boundary. You just clearly define that boundary and make sure that they never step. And if they step, it is dealt with in a strict way. So that minimum boundary you have to define very. So, and it may be different for different families. For example, some families, you know, are more strict about interpersonal relationship. Some are more strict about how they should behave uh, outside, the impression outside. So I think it's very personalized.
Wonderful. Dr. Ila, a lot of our users have sent in their questions that they would like answered. So what I would do now is just read out a few questions, and we would both, in fact, our users want your take on these. So I'll start with the first question. This question is coming from Bangalore. It says, my 7-year-old gets really angry over seemingly small things, like when it's time to turn off the TV. Is this a phase, or should I be looking deeper into how we handle emotions at home?
Right. So 7 is usually the upper limit where we want the kids to develop some form of self-regulation. Maybe your child is a little slow, and we can wait 1 or 2 years to see if he gets there. We have to be patient. At the same time, we have to be very clear about the expectations, especially with younger children. You discuss with them, you set rules based on the mutual discussion, and you stick to it. So often, in when it comes to television, they're so engrossed that they need a few, maybe once or twice, they have to be told the same things. And usually, if you will see that if you give them sufficient warnings beforehand, by the second or the third warning, they'll automatically, turn from the TV, get away from the TV. If it is not happening, if they're not understanding even after the 8 or 9, I think maybe you should consult a pediatrician, talk to it about your pediatrician or your psychologist.
So what we will be doing anyways is sharing a link with our users if they want to have a consultation with a pediatrician or a psychologist. All of this is available on the AUMHUM app. So we will be sharing those. Second question, this is something we've received from Jammu. I struggle to keep my cool when my child has a meltdown. Any advice on how to manage my own frustrations in these moments?
I think Soumya should be able to answer that better. Mindfulness is something we all have to learn. We are all on that journey. Some people are a little ahead, some people are a little behind. But so firstly, again, like Soumya mentioned, for me, I'm only angry when I'm hungry. So make sure you're not hungry. If your hunger and sleep are taken care of, you should work on mindfulness practices.
Wonderful. Uh, I have a long list here that we've received over the week. And just to share with our users that you can also share your questions anytime. Even the link for that is available once you click the link that is shared along with this session. This question is from Lucknow. I feel like I'm walking on eggshells to avoid anger outbursts from my son. How can I create a more peaceful environment without feeling like I'm constantly avoiding conflict? I believe this question has anyways been answered slightly in the previous one, but what would be your take, Dr. Ila?
Yes, I think it's so nice that you're so honest about this. The first step to resolving or reaching a solution is to identify the problem. So you've very nicely identified, you're taking the responsibility. I think you should work on yourself. And in any case, I mean, there's no pressure, no rush to get there. If you think someone else can step in at that time, even if it's just for a few minutes, 5 or 10 minutes, till you just breathe, gain your calm back, and then you come in after 10 minutes. Maybe that will help take care of your own anger and your own reactivity when you listen to your child.
Wonderful. This question is from Jaipur. I'm worried my stress at work is affecting my child and contributing to her anger. How can I shield her from my stress or help her cope with the household mood? I think a lot of questions are coming from parents who
Yes.
look like they are in a lot of guilt. So I would also like you
Yes.
to address a bit
On
the
the
guilt part right? And guilt versus responsibility has always been, I would say, a very tough balance, right, to keep. Your take, Dr. Ila.
Yes, I I'm feeling that maybe you're being, like Viral said, a bit too harsh on yourself, and you're maybe comparing yourself to other families. So take your time and just be persistent. Just don't give up. Stress, your own stress, is something that you have to learn to manage. We are talking about how to help our kids learn to manage stress. I think it's a little late, but it's never too late. So please learn all techniques and all ways in which you can manage your stress.
That reminds me that when we started AUMHUM, the focus of
Mm,
AUMHUM was completely on stress and anxiety. And we
mm,
put together so many ways and mostly for adults,
mm.
to take care of their stress in short term as a bout or over a period of time as an exercise. Anyways, I'll move on to the next question. Uh, this question, it's not clear. I think it's coming. Yeah, it's coming from Chiang Mai in Thailand. It feels like my family is always in chaos because of my child's anger issues. How can we bring more harmony into our home and help him manage his emotions better? I'll repeat it. So it's basically, it feels like my family is always in chaos because of my child's anger issues, of course. How can we bring more harmony into our home and help the child manage the emotions better?
Right. It would have been helpful if you would have mentioned the age of the child, but I'm assuming that it's a smaller child, maybe between 5 to 7 years. And when living, so this is a problem in my own family. My brother's child is one of the notorious ones because he gets super angry. And when you live in a joint family, you see that he very often in the anger situation, it's him against 5 people, which
Yeah.
does not help. So, for example, when I said that we have to talk to them in a calm and composed voice, in your case, now all the 5 people have to talk to him in a calm and composed voice. Even if there is one person who is getting more reactive, it is not solving, not helping. So it's very important that all the members come together and they decide on this common mode of action. And in smaller children, we see that the easiest way is to just give them some time and talk to them calmly and coolly. It really helps.
Thank you, Dr. Ila. I hope this message reaches our users in Thailand. Now, the last question. Uh, Lately, my toddler has been hitting when she's angry. How can I teach her that hitting isn't okay without escalating the situation? This question has come in from San Francisco. Yeah.
Okay. So, younger children, toddlers between 2 to 3 years, they are just too notorious for their bad behavior. And it is simply because they have not learned these strategies yet. So, for such small children, I would say that you focus on their sleep to see if they are not overexerted, if they are well fed. Distraction works very well with such small kids. So you can't really lecture them or counsel them even when they are shant, even when they're collected. Mostly they won't get what you're saying. Distraction is a good technique for such small children. You just remove them from the situation and start, yeah, diverting
That
their
reminds
attention.
me of a personal question I have, which
Hmm.
is nowadays when it comes to distractions, right? I've seen phone ends up being the digital nanny for people. And in my experience, or I would say what I have seen is even that contributes to anger because kids are exposed to an unfiltered array of content. So how do we handle that, Dr. Illa? I mean, it's a personal question, so I thought I would just plug in right here.
Yes, so I have very strict views about phone usage, if you ask me personally, as a pediatrician, because I see so much going on and the ill effects of unmonitored and continuous phone usage. So, not letting a child get bored is the worst crime that you can commit for the child. You should really be okay with it. I know sometimes you think that it's your personal responsibility to entertain them, but trust me, it is not. And trust me that they will know how to handle this. But once you start that habit, once you initiate it, it becomes very, very difficult to get out of it. So my suggestion would be just not to hand. Trust me, till a child is 5, unless he's always seeing you on the phone, he will not ask you. It's only when you start giving and they discover what is in it for them is when they start getting crazy about it. So till 5 years, no phone.
Wonderful. I hope all parents there who are planning and who already have kids. I mean, 5 till 5 years, no phones, large screens. If I heard that, or I mean, and so this brings us to the conclusion of this short, really short one-on-one. And I would like to thank Dr. Ila and Soumya, both of you, for conducting it so well. And if there are any questions, we would from our audience, uh, we will be doing a follow-up session once again. There will be a follow-up episode once we have enough questions that come in from our users and their friends. Dr. Ila, thank you so much, and
Yes,
looking forward to
thank you.
have more of these going forward.
For
Thank
sure.
you.
Short but very meaningful. Thank you, Soumya, for all the questions which made me talk so much. I'm sure next time I would also like to have hear from you and Aviral your experiences with OMHUM so far.
Wonderful. We will do that very soon. Yeah. Thank you.
Okay.
Thank you.
So,
Thank
thank
you.
you.
And viewers, you can follow us on whichever social media platform you are watching this. You can subscribe to our channel, or you can download the app and anytime access this.